Hey everybody, my name is Derek DiCamello. I'm a family nurse practitioner. I own a business. I run a medical spa here in Arizona. I'm also the owner of TMAA and one of the founders, along with my wife Esther, of the Aesthetic Nurse Entrepreneur Facebook group. I wanted to jump on and just give you a little rundown of some of the updates that we've done to the TMAA Business Builder and kind of what we're working on behind the scenes here. So without further ado, I'm going to jump in. I'll show you my screen and we're going to walk through some of these. If you notice up on the top right here of Sage, you've got all of the drop down kind of sub stages. And what this means is we have actually taken Sage and we've gone out and we've pulled all of the information from all of the 50 states. So we've looked at state boards of nursing, we've looked at all the professional organizations out there, and we've gathered all that information back into our database so that Sage is constantly being updated. And we actually have an AI automation that goes out and continues to pull that information and continues to bring it back. Within that, we've also built out some subsections. So you can check these out as well. So you can click on marketing. Say that you really want to build out a 30-day marketing plan on how you're going to grow your business. Well, you click on marketing, that's going to design these prompts in a way that is going to be both compliant from a Facebook marketing perspective. There's very strict regulations out there in the healthcare industry on what you can market and what you can say. And so Sage has actually been trained on all of those guidelines as well. So it's going to keep you compliant. Remember, when you put in your information, so say I come up here and I'm going to go to settings and I'm going to come down to my practice profile. All of this information that I put in is going to save to my profile. And what that means is when I come back to Sage here, I can say, what do I need in order to be able to inject Botox in my state? And what you're going to see is Sage actually knows that I'm a nurse practitioner in Arizona and that I've got full practice authority. Another thing that we built into this was the ability to both ask those clinical questions, but also get those forms and those handouts. So, for example, I have a patient who came in and they were really overfilled on their lips and they want me to help them with this. Walk me through dissolving with hyaluronidase and talk me through dosing, kind of talk me through the safety aspects of this and the risks that I need to be aware of and what I need to tell the patient. And once this goes through, what you're going to find is that this is actually a really good baseline. And then you can actually go through and ask follow-up questions. The more information that you give, the better answers you're going to get. We actually added some really quick buttons down here. So we've got patient handout, we've got an SOP generator, we've got a protocol generator, and then we've got consents, a complete protocol that you can print and use for doing this. In addition, you can do a patient handout. That's one of my favorites. I think that just gives them something in their hand and you can do that quickly and on the fly right there in your clinic when you need to do it. We're really building this to be used at your table. Lastly, I'll point out here before we move on to the next section that down here on the bottom, we also put in an export. So you can actually export this right here as a PDF and you're ready to go. Sage GLP-1 was trained on everything in our Master GLP-1 course. With the Sage GLP-1 AI, we really broke down everything that you need to do, not just from a prescribing perspective, from an education perspective, but also those lifestyle factors. This is going to be a really great way to help you think through and troubleshoot those difficult patients that come through your door. We all have them. We do everything we can think of to get it right, but we're still not getting those results. This is going to really help you to pinpoint that missing piece that you're just not really connecting with yet. We can use one of our pre-filled prompts here. So this is create a first consult for a GLP-1 workflow for a new weight loss patient management. And so what this is going to do is it's going to help us to build that practice workflow for seeing this patient from the time they come in, how to get them screened, how to go through prescribing, all of those pieces. And what's cool about this is once this is done, is this is going to open up, we can actually use our quick buttons that we put at the bottom here. You can always turn that into a document. So for example, here, I can come through and say visit summary, and it's going to take whatever we were talking about, the context of that conversation, and it's going to turn it into a document for us. So in this example, we were talking about that first GLP-1 consult. This is going to give us that after visit summary. The other piece of this that I wanted to show you was in the library, we have different pieces here. So we've got clinical management, we've got dosing and titration. And what these are is these are just really quick prompts for you to be able to jump quickly to what you're looking for. So for example, long-term care, maintenance, and transition. I can jump in here and say, hey, you know what? I need a quick reference guide on maintenance and transitioning patients to maintenance. And it's going to pop up and it's going to give me that guide. And so that's just a really quick and easy way for you to kind of work through it, those often used things that you might want to come back and reference. So awesome, that's Sage GLP-1. Next, we're going to jump into Sage Peptide. All right, this is our Sage Peptide. And with Sage Peptide, we've actually taken our AI. We've gone through every peer-reviewed research study that we could possibly locate. We've gone through kind of the authorities in the industry. We've pulled from a lot of that information. We've really gathered everything we knew about peptides and put it in here for you to use. So this is going to be specifically trained on peptides, how to prescribe them, patient scenarios, what to watch out for with any given peptide or patient, what to screen for, what labs to monitor, everything you need to know to run a successful peptide practice, you're going to have right here. The library section we actually built on the peptides themselves. So we can go through here and say, hey, sexual function, and one of our favorites, our PT141, it's going to give you a quick guide here. And then as well as these buttons down here and say, hey, you know what? I need a patient handout for this. So I'm going to click patient handout and it's automatically going to give us a self prompt for Sage to build that for us. Another cool thing is, say we've built our patient handout, and I'll give this just a second to finish up as it loads here. So once it's done here, what it's going to do is a couple of things I want to point out. One is it's going to give you the sources. So this is going to show you where did it pull this information from. So it backs it up with places that you can actually go and look up for yourselves. The second thing here is you're going to be able to one-click button, build a protocol, print a patient handout, create an SOP, or even compare. So we can say, hey, I want to compare this to something else, right? And look at the differences in those. And so it's just a real one-click button to be able to draft those. One thing that with the Sage Peptide that we really tried to do is be very transparent. We do know that there's some peptides out there that don't have the most robust clinical research available for those peptides. And so when that is the case, we wanted to point it out, right? We wanted to show you that, hey, this is a grade A evidence. This is a grade B, right? There's human trials. There's no human trials, so that you can really make those best clinical decisions for you when you're prescribing these medications. The other thing that I wanted to point out is this is going to be amazing for those patient situations that you're really thinking, hey, I don't know where to start. Which peptide should I be thinking of here? So in this case, I had one female patient in her 60s. She was postmenopausal. She's really struggling with fatigue. She's been trying to go to the gym, but hasn't been getting results that she wants. She's having trouble sleeping at night. And I said, hey, can you help me think through what the best protocol for this patient would be? And in here, you can see it really broke down logically what our core problem was, what protocols we could consider, which way or the sequencing of those protocols. So what should we do first, right? Month 1 through 3, 3 through 4, 4 through 6, month 5 and on. You know, what are we doing? How to select the right patients in this situation. So in here, it's telling us rule out primary hypothyroidism before starting, right? So make sure there's no thyroid issues. Make sure there's no malignancy. Look at the fasting glucose, look at hormone replacement. So it's really going to help you think through that entire clinical scenario when you're making those decisions. Let us know if you have questions or if you have suggestions. If there's something that you would love to see be built in here for you that would help you in your practice, let us know. What's cool about this is going to be a really easy way for you to build out your entire policy and procedure manual on the fly when you need it. The only requirement I recommend before you start this process, gather your complete menu of services that you offer. That's going to really help you when it comes to generating this policy and procedure. I'm just going to put in some generics here to get us started. We do want to put the state, so the state is required because it's going to actually use AI on the back end to pull what's required for your specific state. You can put in your practice logo, you can put in your brand colors so that it looks brand specific. And then I'm going to jump in here and let's just throw in a few folks. We have an RN with us, we've got a medical assistant, we've got a master esthetician, and then it's going to have a whole list of services for you to be able to use. Now, this section is where you can really specifically dial it in for your clinic. And then additionally, because we knew we couldn't capture every service out there possible, you can go in here and add a custom policy or a custom procedure that you do that maybe you didn't find in the drop-down list. And then we are going to jump in and say create the manual. Now, the caveat on this is it takes a minute. There's a lot of sections in this manual. We made it super, super in depth so that you weren't missing anything. And so if we jump in here, it's going to start generating and it's going to start building out all of these sections. So as you can see, it's going to take a minute. Okay, and it looks like we're done and we're back. Okay, so a couple of things in here once you jump in is, one of the questions that we always get is how do you edit these? So the first way to do that, you can regenerate it just on the fly. This is the way that I like to do it. So you click AI powered and you just tell it. You tell it exactly what you want to do. So you can say, hey, I don't like the way that this is worded. I really want this changed a little bit. And it will update those however you like it. And then the other way is you can manually go in another core value. And you can manually edit in and save it, and it's going to be on there. The other piece that you can change on the fly is your branding. So say you don't want to have to regenerate this whole thing, we can go in here and say, hey, we're going to add a tagline, or we're going to now add our practice logo, or maybe you updated your address along the way. So you can change all of that stuff here. You can click on manage, and this is where if you don't need a section, say it doesn't really apply to you, you can go ahead and delete it. You can also add sections in here. So I can jump in here at any time and say, you know what, I forgot we actually do sclerotherapy, and it's going to go through and add that to the protocol itself. And then the last piece here is, again, that custom section. So you can go in here and type in what you want that custom section to be called, as well as what that means. And then whenever you're ready, you can hit the print button and export it to a PDF, print it off, and then come back here anytime you need to make a change, and you're golden.